Hi, it's Karen D, speech language pathologist. I wanted to talk specifically about a phone call that I took a couple days ago from a parent who was concerned about some things that she could do at home with her kiddo who has some respiratory issues, and she's on a variety of medications. So basically she is immunocompromised and wanted to know what can she do to get her daughter stronger. So some of the things that we talked about were just in regards to her overall respiratory hygiene. What is she doing to make sure that sort of those day in, day out factors are being controlled? So that is allergy medication. If she has allergies that she's been tested for, they need to be on top of that. They need to make sure that she is taking her allergy medicine every day, that if she has nasal sprays, that she's using those every day. We really want to make sure that the mucosa of the nasopharynx, oropharynx, all of that is staying moist. So that means using a nasal spray, even if it's just saline, making sure that the nose is very moist so things are not just readily going through the nasopharynx down into the lungs. We want the mucus, the mucosa to stop things before they can get to the lungs as quickly as possible. Really want to encourage nasal breathing. Again, that's going to be a vasodilator when we get that nitric oxide breathing through our nose. It's very important to do that to keep everything from swelling and that inflammation from occurring. When we are breathing through our nose, we are producing more nitric oxide, which helps maintain better inflammation responses. So make sure also that if it's appropriate, and again, this is something talking to that individual parent in her responses and work with their pulmonologist, with the ENT, they had already been discussing using a humidifier at home. And so I asked her, were they using that? And she said, no, at this point they were not. So making sure that if you have a pulmonologist, an ENT, and they have made recommendations in the past, please implement them. Please use those right now. So in regards to using something like a humidifier, she needed to make sure that it was actually close enough to her daughter that at night when she's sleeping, she's benefiting from it. If it's all the way in the corner, more than 3 or 4 feet away, she's really not getting the benefit of it. So making sure that implement those recommendations that have already been made in the past by the specialists that you see on your team, and make sure that you're using those specific recommendations at their best, in the best way that you possibly can. Also talked about other things, other comorbidities that might exacerbate respiratory distress, such as reflux. What can you do to diminish the signs and symptoms of that? If you know that specific foods are going to exacerbate that, you want to make sure that you are not eating those things. I know sometimes it's tempting to indulge or have whatever it is that you want, but this is not the time. So try to find another way to manage with wanting to do those things, so that way you really keep that reflux in check. Also making sure staying hydrated, adequately hydrated, is so important. Really want to make sure that you're drinking enough so that the mucosa, again, of that whole nasopharynx, oropharynx, all of it is hydrated. Want to make sure you're doing that. Lots more to come, but just wanted to give a brief review of some specific pointers that I made with a specific case study, so that if you find that some of those details pertain to your situation or a loved one's situation, that you might be able to implement some of those recommendations right away. But as always, please check with your medical provider when you get a chance. Thank you.